Today I'm going to be discussing about top 5 questions searched about varicocele and its treatment in India. Because varicocele, it just doesn't cause the pain in the scrotum. It is also one of the important causes of male infertility, and treatment of varicocele can help in improving fertility rates in men. Let's look at the top 5 questions searched about varicocele treatment in India. These are the top 5 questions. What is the best treatment for varicocele, microsurgery or embolization? Does it need surgery? How long is the recovery period? Does it affect fertility and semen quality? And what is the cost? Let's look at the first question. What is the best treatment, microsurgery or varicocele embolization? Microsurgery as well as varicocele embolization both are approved treatments for varicocele. Varicosilectomy is a surgical process, whereas varicocele embolization is a non-surgical procedure. In varicocele, there are abnormal dilated pampiniform plexus or the veins in the scrotum which are having the reflux. So the goal of the treatment is to block this reflux. In microvaricosilectomy, there is a small cut or incision in the groin region and which the veins are ligated, whereas in varicocele embolization, through a means of catheter, just like an angiogram, either from the neck or the leg region, the veins are approached and then the veins are either coiled and glued so that the reflux is stopped. Varicocele embolization is done without any spinal or general anesthesia under local anesthesia. Both methods have similar success rates in experienced hands. Second question, does varicocele require surgery or can it be treated without surgery? Many patients are actually surprised to know that varicocele can be treated without surgery. Traditionally and conventionally, the varicocele treatment has been surgical. The non-surgical way of treating is through the means of varicocele embolization, which is minimally invasive, without any sort of cuts or stitches in your groin region. It is done under local anesthesia. The recovery period is 1 to 2 days. The patient is discharged on the same day or the very next day. Third question is, how long is the recovery after treatment? In case of a microvaricosilectomy or a microsurgery, usually the patient is advised for up to a week or 1 to 2 weeks of a rest, whereas in case of varicocele embolization, it is 1 or 2 days. You can return faster to the work within next couple of days. The next question is, will varicocele treatment improve fertility and semen quality? To answer this question, first you need to understand that varicocele is one of the cause in primary infertility in men. Varicocele, because of the reflex, the blood which is supposed to go away from the scrotum settles down, and because of the increase in temperature, there is chemical mediators within that decrease or reduce the sperm quality and production. So post the reflex is abolished by the means of a surgery or varicocele embolization, there is improvement in the semen parameters that ultimately helps in improving the sperm quality, further leading to a better fertility rate in men. Final question, what is the cost of varicocele treatment in India? This is a most commonly asked question. The treatment varies because it differs from metropolitan cities to a smaller towns, varies from hospital to hospital, specialist to special, whether it's a surgical or a non-surgical. So the common price range varies in few thousands can extend up to a lakh, or it depends upon one side or both side and whether you're looking for a surgical or a non-surgical treatment. So always best is to visit a center which has both the facilities so that you can discuss with the relevant surgeon as well as the interventional radiologist and take an appropriate call that suits you. The goal of this video is basically to make aware that varicocele is a treatable condition, and as varicocele is one of the common cause of not just the scrotal pain but also the men infertility, so treating varicocele can help in improving the fertility rates in men. Varicocele can be treated without surgery by means of varicocele embolization, which has got a faster recovery rate and early mobilization.